Thank you very much, Professor Sham. I'm delighted to be here and very excited by the last couple of days and looking forward to the next one. So, a positive culture is incredibly important in so many aspects of research, and we've discussed it and we will continue to discuss it, I'm sure, for a very long time. Much is written. We've heard an awful lot over the course of the last few days about how misaligned or misunderstood incentives can drive behaviours in a way that are not helpful. Whether that is around pressures faced at the beginning of a career to mark yourself out, or it's around pressures to get there first later on in a career in order to maintain funding. So this is really important, and trustworthiness in research underpins the whole enterprise on which we are working. It basically builds the trust for our own collaborators, the way we work together, but it's also public policy and government funding which is reliant upon it. We've also heard from some speakers today, and I'm sure we will continue to hear, that actually none of this and none of us operate in isolation. We're all part of a very interconnected system, and taking that system's perspective will be a theme that runs through the talk that I give this afternoon. And as funders, we are a partner in it. We've heard that we've got influence. Yes, we have, but we're not the only ones who have influence, and we're not the only ones that matter. So it's incredibly important that we act as responsibly as we are asking researchers to act. So what I'll do is I'll give you a brief perspective, shine light on a couple of examples that we have worked on in relation to work that Wellcome's been doing, and I will explain a little bit about where we're going to from here. So common in all the settings in which I've worked in, Maha said I was a developmental biologist. I trained as a chemist, I've worked as a research technician, I've worked in a hospital as a biochemist. Trust underpins all of that. Understanding the context in which we're working is important, and making sure that we understand and listen to others' perspectives, because charging on regardless actually just diminishes trust rather than builds it. In my current role, I look at culture, I look at trust in research, I look at the whole question of careers and a positive environment for that. So I don't need to make the case any longer. What I will do, though, is I will tell you a little bit about Wellcome, the organisation. I was intrigued to find out last night as we were walking back from dinner that there is a supermarket in Hong Kong, which is also Wellcome, or called Wellcome. But actually what I wanted to do was tell you a little bit about the organisation. We are physically located in London, and our work supports 14,000 people in about 100 different countries. So Wellcome as an organisation is an independent global charitable foundation, and we are dedicated to understanding and improving human health. We were established under the terms of the will of Sir Henry Wellcome, who was a medical entrepreneur. He was a collector and a philanthropist, and he made his fortune by essentially working on the precise formulation of drugs. We invested this endowment and now have an endowment of about 26 and a bit billion pounds on which we can draw down, and we plan to spend in the region of about £1 billion UK on our charitable mission every year for the next 5 years. Our mission is relatively simple but very broad. It's about improving health for everyone by helping great ideas to thrive. And within there is a whole multitude of issues, and I'll tell you a little bit about those. Very importantly, as a foundation that doesn't have to raise money, as a foundation that doesn't have to rely on funding from government, we need to think very carefully about where our accountability lies and to whom do we rely on for the trust and the sort of, I suppose, license to operate as an organisation. We are actually accountable to society for delivering this, and we use our independence very explicitly in what we do for public benefit. So what do? You'll be familiar with Wellcome possibly in relation to the types of funding that we give. We fund research of all forms. The Sanger Institute is a very famous genomics institute. We fund big research infrastructure like the Diamond Synchrotron. We fund units in Africa and Asia to tackle some of the sort of global tropical diseases. We actually work on priority areas such as climate change and population health. and we fund new types of research that we were talking about earlier today, such as trying to understand upstream determinants in public health prevention. Those are the processes that underpin life, but that's not all that Wellcome does. We have a really strong culture and theme around understanding social and historical factors. We look at making sure that we inform and excite people. How do we build the trust in the people that engage with research? So we have our own collection, we fund long-form journalism, we fund programs into schools. All of this is around trying to build the trust. We actually also make a very conscious effort to try and inform policy. And some examples listed on this slide give you a bit of a flavour for that. One I'll tell you a bit more about in detail. So, for example, we very recently launched the Coalition for Epidemic Preparedness and Innovation, the CEPI logo that you see up there, with the World Health Organization. And that is critical to our endeavours in Ebola. It's about helping build the trust, understand the system in which it works, so that we can predict, manage and alleviate epidemics. We have just started to launch an initiative, particularly on snakebite, and part of that's around the sort of public policy side of it, part of it's about the manufacturing. And those sorts of things are important because manufacturers are pulling out of this for a variety of reasons. And then the bit on the top right of the slide is the PhD side of things. We are influencing policy change around PhD training to specifically get culture ingrained in this. I'll tell you more about that in a moment. The neural picture that you see up there is but to remind me to tell you a little about the International Brain Lab. This is a really interesting area where understanding equivalence in the way that researchers interpret, design and report data is critical. So this is a group of 21 internationally eminent laboratories, all who are trying to undertake the same paradigm in neurosciences. It's co-funded with the Simons Foundation in the US. And the idea there is, can we get a paradigm that is conducted in exactly the same way, reported consistently, that makes the data interoperable? And this is just another example about how Wellcome is thinking about the broader issues. So we have a very top-line mission. We look at, in more detail, when we think about funding and science and research more generally. And the first three on that list will be no great surprise to you from any funder. We look at knowledge creation for knowledge's sake, because that's important. We look at capability, whether that's people or infrastructure. We want to make sure knowledge is used effectively, all those principles that people have talked about throughout the conference. But we also are very interested, and this is where my role fits in promoting an environment in which research can flourish. And the whole question of research integrity and trust is critically important from that. Where we fund globally. So although you might be familiar with us sitting in the UK, we actually fund 474 organisations in 97 different countries. Although it has to be said, 74% of our funding is in the UK. And that's the current makeup. We are undertaking a review of science at the moment. A couple of my colleagues also in the conference today can tell you a lot more about the detail of the grants we receive, but just to give you some figures, last financial year we received nearly 5,500 applications. So thinking about how you build rigour and trust into the assessment of that is quite a challenge also. So, we've said that we're accountable to society for delivering Wellcome's mission. And how do we go about doing that? Well, what we've done, and how do we bring ourselves to account? We have developed a framework which is essentially referred to as our evaluation framework. This is published, it's on publicly available. And what it's tried to do, this looks deceptively simple. Those who were involved spent an awful lot of time, it was months of work, to try and get something relatively simple. And what we've tried to do is be clear about the importance of the transparency with which we articulate our ambitions, and it helps us guide what we do. We want to be evidence-based. So if we're clear about these are our ambitions, the question is, how do we evidence that we are actually making any progress toward these? How do we evidence that what we're doing is not harming the endeavour which we are seeking so hard to protect and develop positively? So what I've highlighted on the right-hand side of that is 5 areas where the ambitions that we've set ourselves specifically relate to the themes in this conference. We want to know that our knowledge and discoveries are shared and they're easy accessible so that we can maximise benefit. We want to know that we are using the highest appropriate standards, and that's not setting a standard, because there will be different standards depending what field, what sector, the state of affairs of all sorts of different things. We want to know that discoveries are translated, and that's in the broadest sense of the word of translation. And we want to use that in order that we can change policy and practice for the better. And we know that having trust in Wellcome as an organisation is an ambition, but it's more important as well that it's science and health research that's trusted. So, with that very large ambition, where on earth do we start, and how do we provide the evidence on which we need to build? We are looking at the moment at systems methods. Many of you will be familiar with these. The sort of really messy chart on the left is just to show you that when you try and dissect all the relevant factors that can influence an outcome, and you're looking at all those upstream determinants, you get into very messy territory. What we're looking at is whether, and this was from Tackling Obesities, which is almost sort of 12 years old now, and what you get is you understand that they are themes that allow you to conceptually frame what you're working on. And I think this is particularly relevant to research integrity and trust more generally. What we want to know, the smaller chart down there, tells you that if all you treat is a symptom, all you do is put a policy in place and you treat the symptom of it, you're not actually treating or finding a fundamental solution. So what we're trying to do is understand that actually the work we're doing in relation to trust and integrity doesn't have hard boundaries. There are multiple moving parts to this. There are different power balances with the actors that are in these areas, and we need to try and understand that as best we can without getting bogged down in it. So the process of inquiry around systems methodologies, the way we're approaching it, is to try and help us make sense of the world and improve it, and use the principles from this as a bit of a learning tool. The other thing that we think is really important is to understand where we're acting and where the interrelationships are. And this is a pictorial sort of representation, if you look at the top of it, where you say the hardest thing to change in anything is the values and beliefs of an individual. Those are so ingrained and so sort of influenced by a variety of factors that probably isn't the thing you're going to achieve first. There are a number of different levels, all of which interact. And as funders, we are great at putting policies in place. We're great at putting another grant scheme in place, giving you really precise criteria, not necessarily evolving it. If that's all we do, then we're really not going to make progress. So the other thing we need to understand is where in the organisational level does this fit? How do we work productively with organisations? Whether that is learned academies, institutions that are employing research staff who are undertaking the research themselves, whether it's governments, we need to understand and work with that. And actually this grouping here at this conference, you are a community of practice. You have a massive influence on what happens. And if we can join up these various levels and understand the interplay, then actually what we can do is identify hotspots where we might be targeting specific action. We heard about the Embassy of Good Science. That could be one such hotspot. There are others, of course. So in terms of what we're doing, I'll give you some examples. But just as an overview, we have policies. We have policies on good research practice. We have policies on bullying and harassment, which obviously impact on integrity. We are part and signatories of a UK integrity concordat, and there are other national concordats that also exist. And we have open access policies. What's important to note, and this chart on the bottom left there just shows that when we're mapping or looking at all the relevant things and places and organisations that we need to work with in the UK in relation to trust in research, there's a lot out there. And so what we need to do is think about ways in which we can join some of this up. And that's what I'll tell you about in just a moment. So, a couple of examples of that in slightly more detail. We're talking about integrity here, but trust and perceptions of science and research actually do make an impact. This is work being led by our public engagement team, and it's called the Wellcome Global Monitor. What we've done is we've teamed up with Gallup, the survey company, the survey organisation, and it's the world's largest survey into how people around the world think and feel about science and major health challenges that they face. What we've done is we've gone out to 140 countries with 140,000 responses, and the survey results will be released live time on the 19th of June. I can send this round or you can photo, but there's a website link there where you could listen live. If any of you are in DC, there's a link that you can go and listen to the results. But the idea is that the data from this and recognising that we need to be compliant with data protection regulations, will be released, and we want researchers to use the data in all sorts of different ways and to be open about sharing it. So that hopefully will generate a resource, not that will tell us exactly what needs to happen, but it's on which we can build. It's helping set the baseline, and this is a theme that I think is important for all of us. This one is something, the next one is one that you know about a lot and will divide opinion, I'm sure. When we talk about open access, I think it's a useful case study. And it's from one that we must learn from. Essentially, if we're looking for systemic change, we need vision, we need commitment, we need to be in it for the long term, we absolutely need to collaborate, and we must evolve. And sometimes you need to act and work alongside, sometimes you need to work alongside and then act. This has got a bit of both in that. But what I think it is a useful case study to show is that it takes time to do this. So we published an economic analysis of scientific research publishing in 2003, and we're now in 2019, and we haven't got as far as we thought, but there are still things to learn. And even just last week, we evolved further by delaying the timeline for implementation of Plan S. So I just think it's a useful case study to think about. And this is one where on the policy side, Wellcome is working very, very forcefully. The next one I want to frame for you, and this is something that people have talked about a lot in this conference, around training, the importance of training, the importance of looking after the careers of individuals coming in. We undertook in 2017 a review of PhD training, and ostensibly this was from a very funder-focused perspective. Should we fund PhDs anymore as a foundation? Why should we? What's left to do? Should we move out? What we found from the review, that when we started funding PhD students about 20 years ago in the form of, what we do is we fund cohorts. We put groups of students together, we make an award to a university, and the university is responsible for taking cohorts of students through. We wanted to raise stipends, we wanted to have 4-year training, and all those things by and large in the UK had worked. But what we found from our survey was that actually there were things around the culture of training that were critically important still to address. There were some of these wicked problems that persisted in the system. We've made the data from this all that's compliant with the data protection publicly available. And these are the headlines. What we found was that supervision wasn't necessarily ideal, whether that was around making sure that students had a clarity of expectation around a whole bunch of things. What was expected from them in terms of research, what was expected from them actually in relation to integrity and good research practice. Those weren't clear, methodologies weren't being shared, tools weren't being shared, and we've heard a lot about how we might do that here. We found that actually thinking about career transitions, both into and out of PhD training, was tough, and people were disillusioned for a variety of different reasons coming through. Mental health is a critically important one, and if we think about the incentives and some of the problems that we're thinking about with relation to research integrity, then actually these relate as much to the views that people have got about their own careers more generally. When we looked at skills, funders love to have a list of checks that they can make on things, and we decided to keep this as light as possible. And the only thing that is absolutely mandatory for all of our PhD students is good research practice, completely mandatory. But what we didn't have is we didn't have clarity on precisely how that might be done. So we are building that into the programs that we are running now. And interestingly, when we talk to supervisors, we asked them the question of how would you judge successful completion of PhDs? And it was split, a third. A third said thesis completion, so just handing it in and doing it, which was great. Career progression into a career that utilises those skills, also good. But a third said, we'll have a first author publication, thanks. And by the way, that should be in a one-word journal. And what that does is it really skews the way that PhD students coming through are being trained, and it's a question there of some of the poor practice that you might see coming through. We poll our students lifetime when we have them in. First years and fourth years we've seen. There's about 30 to 40% of them who will, on an anonymous Slido poll, say that they have already experienced, either directly or with some of their colleagues, issues to do with poor research conduct. I also think that what we need to do as funders is look at examples from other sectors. This is an article that came out very recently from the Boston Consulting Group about organisational change, And I think it's relevant to us here when we're thinking about how we make systemic change in integrity. We need to be realistic about what we can actually physically do, which is why that collaboration is so important. What's within our control, what's within our partners' control, and how can we come together to deliver it? We need to foster trust and reciprocity. That's critically important. And experiment frequently. The poster hall is full of wonderful examples of how experimentation is working. And then we need to sort of pick the ones that are likely or seem as if they are showing most promise and enhance those and amplify them collectively. Nobody owns, I think, the mandate to collectively sort of say that, you know, they have sorted research integrity. This should just be the way we do business, and it's a collective pre-competitive endeavour. This is what I'd like to leave you with. We won't change if we act alone, and that's as a funder, it's as a researcher, it's as an institution, it's as government. This is, I think, a collective call to action, which is why the manifesto that we've been discussing over the course of the last few days is really rather important. And what I'd just like to do is say thank you very much for your hospitality, the absolutely wonderful engagement from all the discussions I've had. My two colleagues from Wellcome are sort of mid-centre of the row up there, and I'm sure they'd be delighted to answer questions in the breaks if you have any. So thank you very much.
Thank you very much. The floor is open for questions and discussions. Just please.
Thank you very much. My name is Nick den Hollander from University of Leiden. I'm really intrigued by the trust because we have sort of a trust crisis in the Netherlands. At the moment we have, let's say, measles back in babies because our vaccination rates are going so much down. And I'm wondering, these people, they don't trust anymore, but they're very high educated. So how can we reach that group? They don't believe anything. So
a very, very valuable question, and this was about sort of vaccination and how we make sure that we can engender trust. I think the issue is we have to listen to what the concerns are and understand those. The monitor that I mentioned, the global monitor results, have got a specific question set about vaccines and elements of trust, and there's some really interesting data in there. And I think the critical thing is to, just because we say it doesn't mean people believe it, just because it's evidence doesn't mean that, you know, people accept it, just because we've said it one way doesn't mean we've said it the way that people will understand, engage with, and what have you. And I think that's where that systems approach is really important, because we need to understand actually what is it about that isn't necessarily going right. And we need to adopt a variety of different strategies that go almost all the way back to, you know, kindergarten and schools and working with, you know, religious leaders and thinking about how policy gets made and joining those things up so that there's a thread that runs through them. And it does come down to the question about making sure that, you know, all the questions we were talking about this morning about ensuring that when we are, you know, doing review of studies, that we make sure that we're as rigorous as we can about those sorts of things, because the damage that the Wakefield paper has done is phenomenal. The other thing, actually, we need to change the stock image on screaming babies being shown a hypodermic. I'm not sure that's helping us.
I have a question myself. So, Anne-Marie, you talk about a lot of really wonderful initiatives set out by Wellcome Trust. How does the grant body work with the institutions, which at the end is to really realize a lot of the wish that you list out?
Absolutely. So if I take the PhD programs as an example in point, the whole point of highlighting the cultural issues was not that we dreamt them up overnight. We worked with research institutions to do that. The way we're conducting the peer review for that and the way that we communicated the whole studies was to work with the PVCs for research. We worked with the deans, we worked with the principals of the universities, and we worked with the graduate colleges to better understand actually how did the system operate. And they helped us shape this, so it was very much co-created. And what we're doing is providing them with the levers that they would like to have in order to do that. And we're going to build research into that programme to understand, working with anthropologists and social sciences, what is the impact of what we're doing and have we got it right. And we'll build communities of practice with the institutions also, so that it's very much co-created and we're turning the tables on ourselves.
So with that, thank you very much.
Thank you very much.
Yeah.